Dr. Libby at the Implant Center of Miami. As a community member, mother, and team member, I would like to discuss an issue that's facing all of us today: coronavirus, COVID-19. So we're being told a lot where to go, where not to go. We're getting so much information on the news. Coronavirus is out there. We're being freaked out by it. And there's a lot of information. Nobody really knows what's true, what's not true, and it's just a lot. So we're being told not to congregate in certain places. There are plenty of public parks that are closed. Basically, any place where groups of people can get together are no longer a possibility for us. And the world is a changing place. Places that we are allowed to go, but there have been plenty of restrictions placed, are places like supermarkets, shopping malls. Shopping malls only recently opened, but supermarkets have been open this entire time. So we're being told that we have to take special precautions when we go to these places: wear a mask, wear gloves, you have to separate from people. Some supermarkets are only allowing a certain number of people in each supermarket at the same time to allow for social distancing. But even places like supermarkets that provide essential needs, they're not places that can really be considered sterile. The workers in a supermarket cannot just go around and take every bag of potato chips and wipe them down with a Cavicide wipe like we can in our dental offices. So it's still a risk going to these places, but protocols are in place to make sure that it's at least the healthiest possible way to go to these places. A dental office is a little bit of a different situation. On a day-to-day basis, our standard protocol involves sterilizing every instrument that is even open from the sterilization packet, whether it's used or not. Every room is turned over between the patients, and there's a lot of things that we do to make sure that it's a safe place. Now, you might wonder to yourself, why on earth would I go to a dental office during this coronavirus pandemic? It's a place where people's mouths are open and there's germs flying everywhere. Well, there are plenty of new protocols that, according to the law and according to the CDC, that we have had to introduce to keep it as a safe place. Why would you want to go is a good question, though. During coronavirus, it is very important, of utmost importance, that your immunity is strong and healthy. So a lot of systemic diseases can originate from the oral environment, or you might already have a systemic disease that can be exacerbated by an infection in your mouth. So maintaining good oral hygiene and good oral health, eliminating any source of possible infection, is vital, especially during a time like this, in order to maintain strong, good immunity, so that if, God forbid, you are infected by this virus, it is something that is surmountable, and it is something that you're more likely to overcome and be stronger afterwards. In addition to some of the standard protocols that we always have to do on a day-to-day basis, some of the new protocols that we've had to institute have been involving wiping down more surfaces with Cavicide wipes. Cavicide is a material that is virucidal and bactericidal, so it basically kills everything in sight with a 1-minute kill time. We've always placed plastic barriers on pretty much every surface that we touch in the operatories. As far as the assistants and the dentists are concerned, every single person has a whole new set of gear that we need to be wearing so that we don't transmit anything to you and you can't transmit anything to us. So it maintains the dental office as a safe place for everybody. On my end, I need to wear a gown over the clothing, then an N95 mask, then a surgical mask over it, then a pair of glasses so that I can see better, and then a face shield and a hairnet so that every possible surface is covered, and in addition to, of course, rubber gloves so that anything that I'm touching in the mouth is not being spread anywhere else. In addition to all of these sterilization techniques and the new protocols that we've had to introduce in making the office an even cleaner place than it already was, we have a whole new protocol for screening the patients to make sure that they haven't been exposed to the virus. Every patient that comes into our office is given a questionnaire beforehand. One of the questions is asking if they've traveled to any foreign countries in the recent past. If they have, they are not allowed inside this office. If they have any symptoms that are related to coronavirus, such as a dry cough or fever. And every patient's temperature is taken once they come inside the office and logged in a log that we keep every day. If it's above 100.4 degrees Fahrenheit, they're sent home. Every single room in our office has an air purifier that clears the air of any micro droplets that are coming out of the mouth and any aerosol that is happening from the handpieces that we use every day. So I hope this short video has given you not only some comfort in coming into the dental office, but an understanding of why it's actually necessary and might help you in the dealing of this pandemic. I hope you're a little bit more educated today, and I hope you have a great day.